This is the Global Health Impact Index, a rating system that evaluates pharmaceutical companies' attempts to extend access on essential medicines around the world. Companies' scores are based on their malaria, TB, HIV, and AIDS medicines' global health impact. The index opens the door to many ways of promoting global health. It provides essential information for companies, researchers, policymakers, socially conscious investors, consumers, and the general public. Consider just one way of using the information the labeling system, our rating system provides. Using the rating system, it's possible to give the best companies in a given year a label that they can use on all of their products, everything from pet vitamins to mouthwash that they make. If only 1% of consumers prefer global health impact products over-the-counter and generic products, that would be $360 million worth of incentive for companies to extend access on essential medicines every year. That's about the price of a new drug per year on a reasonable estimate. I want to tell you today how we construct the index. So there's basically 3 steps here. The first step is to do an effectiveness analysis to determine promising drugs' impacts, okay? And that's the hardest part, so I'll talk about that. We can then rate the companies based on aggregating their drugs' impacts, and that will allow us then to rate the companies either by their relative or absolute standing. Again, the hardest part is to determine the drug's impacts. And to do this, we look at 3 things. The need for the drugs, the percentage of people who can access them, and their efficacy. So consider a simple example, toy example. Suppose 100 million people die from a disease in a given year. If 50% of people have access to the medicine for that disease, and there's one medicine, then we would assume that that medicine could save 50 million lives at best. And then if the medicine's only 80% effective, we'd estimate that it would save about 40 million lives. In reality, we look at the disability-adjusted life years lost to the diseases, which is a measure of both the death and disability due to the disease. We look at global treatment percentages, and we look at efficacy data from clinical trials. Things are a bit more complicated than that because you need disease models and you have to look at different patient groups and so forth, but that's the general idea. So once we have these drug scores, then what we do is we aggregate by company. And you can take a simple example again. Suppose one company makes 2 drugs, let's say 40 and 60 million life years each. Then you can aggregate those and you might get a score of 100 million for that company. Another company might make 3 drugs and save 10, 20, and 30 million life years each, and that company then would have a score of 60. And so the first company would be ranked higher than the second company. Here's a map of some of our data for the disability-adjusted life years lost around the world. Red indicates a low number of dailies lost, and green indicates a higher number. This comes from the Global Burden of Disease study. Here's a sample of treatment coverage information for the main drugs for PFOC malaria, which we're looking at. This is probably the weakest version of the data in our model. It comes from the WHO, however, so we're using that for now. And then we also use WHO information on efficacy for these drugs. This is for erythromer lumefantrine. Actually, this is collected data. We've done a systematic review of data to get this efficacy information. The result, again, is a ranking of companies. Here you see the percentage of the disease burden that's alleviated by the companies together, that's alleviated by each company. So I'd like to thank all the people and organizations supporting the index, my team at Binghamton, Carnegie Mellon, Pittsburgh, and Johns Hopkins for their help in constructing it. And we're currently seeking to expand our network and engage in new collaborations. We hope that one day everyone can support this global health impact rating system and create incentives for companies to extend access on essential medicines globally by purchasing products with a global health impact label, investing in global health impact certified companies, and so forth. Together, we can make a difference for global health. Thank you.